So today this is our standard agenda for product update and system updates. We do have some really important updates that are coming out. And so we want to make sure we're covering those and answering any questions that come up for those. First, we'll review the vision that we have for SyncTimes for the product. Next, we'll talk about some of the new functionality, then the roadmap, things that we're working on in the short term, meaning the next quarter, and long term over the next year or so. And then last, we want to just have an open mic opportunity. So anything that you would like to request, anything that you'd like to brainstorm, more than happy to get that feedback. If you're feeling shy, then feel free to use the chat or use that survey, and we'll get feedback through there as well. So. Great. So this is our product vision for SyncTimes. And so this is as we look at some of the different opportunities and the things that we're evaluating to build, we focus on this statement. SyncTimes is the best-in-class solution to improve the patient and staff experience for forward-thinking health centers. SyncTimes achieves this vision by making it easy to locate staff and resources, communicate patient flow needs, and illuminate health center operations. Interoperability with other systems is critical to best serve health centers. As we look at our agenda today, you're going to see that we've outlined it in these categories. We've started first with integrate. And so we talked about interoperability being critical, and specifically our integrations. We're building out and growing those just consistently every month. We're adding new functionality there. Next, I want to talk about communicate. We have a lot to cover here. I've added stars for this hold to confirm, just because that's an important thing that'll affect the functionality on the tablets themselves. Third, locate. And so I want to just really give a status update on the beacons. That's going to be our only important item there. And last, illuminate, a couple of new things with the reporting that are available. So we'll just jump in with the integration pieces. One of the workflows that happens on occasion, it's not incredibly common, but it does happen regularly, is that a patient will arrive and then for whatever reason, they'll end up canceling that appointment after they've arrived. And we've already on the SyncTimes side have received their information and put them into the waiting room. And so for those patients, we have availability now through either HL7 integrations, or if you're on Athena Health and have an API integration, this will automatically happen. That patient will be removed from the SyncTime system if they cancel their appointment after having arrived. So if they've already come in and their appointment is canceled, then we'll pull that data out of the SyncTime system and recognize that patient's no longer there. This is going to be, like I said, automatic. If you're on Athena Health, this is live, this is out there. If you're on an HL7 integration, we may have to add another message. It should be really simple. It'll be us working with your EHR to just basically check a box on their side to say we also want to include the cancellation messages, and that is typically through an SIU. It's an S15 is the message type. Next, we have an integration with overhead paging systems that we've been doing. And so the idea here is that sometimes you have SyncTimes tablets where code blue or a security is needed alert can come through the tablets. But in other areas of the facility, such as administrative areas or shared areas in the building, you may not have SyncTimes devices. And so we have an option now to integrate through an extension and through kind of a passcode to trigger a text-to-speech message that would say more or less code blue, Springville Peds exam 6. And so indicating what the code is and then where that has happened. And so that's something that we can work with you to help set that up. This is just an example where we have the phone number and then we have an extension. The comma is paused for 2 seconds, and then we can do some tones. And so 1, 2, 3, 4 as an example would be the code that's required. Often this does require just a code in order to say, hey, this is who I am, and to validate that the overhead page is going to come over. As far as setting this up, feel free to reach out to us. It's not overly complicated. You add the phone number and the extension, and then you check that you want to have a phone call come in for that notification, which would typically be a code blue or a rapid response. The only piece that's a little complicated related to this is we do require a code to verify that you do own that phone number, so that there's not a third party getting a phone call. And so to do that from the admin console, you'll want to open up the user that you've created, which would be an overhead paging user. And you have an option now to say show confirmation details, and it'll show you that verification code 6284, just because you aren't going to have access to receive text messages, and you probably don't want to have a phone call that comes over your overhead page that says your code is 6284. You have this option if you log in on the admin console and say show confirmation details, you'll see that verification code, and then you can type that in on the new user account. So those are the two things on the integration side that we're pretty excited about. I think we now have 3 or 4 health centers that have integrated with their overhead paging system and are using that for those medical emergency type situations. Next, we have a lot to cover on the communications. We've made some fun feature sets. So I'm going to just walk through a demo of what's available here. In this situation, we're going to pretend that I am a behavioral health provider. And so I have a subscription for this Department of Test Medicine that anytime the behavioral health icon is pressed, I want to be notified on my computer. And so that's what this means for the Department of Test Medicine. When the behavioral health action is indicated, then I'm going to be notified on my computer. So here I'll have the flow station up. And what's new here is we have a new bell. And so these are the active notifications that are currently up. You can see right now I have behavioral health needed in test medicine exam 2. This icon's been up for 0 minutes. And then if you have an integration with your EHR, it'll show you which patient is in that room. This is really important for a shared department. So as an example, if you have an imaging department and that imaging department wants to know which patients are ready for radiology so that they can retrieve them from the room. This will allow them to see which exam room and then also which patient so they can go into the EHR and start, triggering the workflows for that patient. So I'm seeing active notifications. You also see it here. If I didn't have this, department up, say as an example, I'm managing 80 rooms and I only want to view the 3 or 4 that I'm working with, but I need to be aware of the behavioral health icon for those other rooms, then this will still show that in those other rooms as long as I have those set up in my notifications. And so here we're seeing basically what's pending. The next thing that's new is if I select this icon, then I've got 3 options here. First, there's an option to remove the action. Second, you can make it flash. And so this would be to indicate that it's a higher priority, or maybe we need an MA stat would be kind of the functionality there if you flash that action. And then third, I have an option now to respond to this behavioral health request action. There's 5 options that we've put into the system thus far. I have the option to say I'll be 5, 10, or 15 minutes. I have the option to say yes, just a general confirmation. Or I have an option to decline and say no, either I'm not available or I'm out of the clinic, something like that to indicate no, I won't be able to make it. For now, I'm going to indicate, yep, I'll be there in 5 minutes. And that communicates to the teams on the tablets and on their flow station that that 5 minutes has been indicated. Here you'll see on the tablet that you see BH and then just the 5 minutes. If you hover on the icon on the flow station, it will show who has responded, when they responded, and what they responded with. So here we just see Alan confirmed 5 minutes, and I did that 0 minutes ago. If multiple people reply, you'll just see those icons stacked like pancakes. They're a little offset from each other, so you can see if they're green or red. And then if you hover on it, you'll see anybody who has replied to those icons. So I think some of the workflows that we have seen this request for, definitely integrated care. So integrated behavioral health, integrated dietitians, integrated clinical pharmacists, and then also anytime you have patients that are being retrieved and brought to a lab or brought to imaging for a transfer, those are all things where we see this response as really important. And so we've had some of your health centers already may have another icon that your staff has been using as a confirmation icon. So as an example, you might have an icon that's dedicated that says 5 minutes or 10 minutes. And so this is just going to be a more built-in way in the system to communicate that and to tie it back to a specific action. Next, related to these, this active notifications pane, you're going to see if there's a code blue, whether you're subscribed to it or not, any icon that notifies everybody in the clinic is going to show up here, and it will pop up when that action is triggered. So you'll hear, as an example for this icon, if I had this up on my desktop, I would hear Code Blue Assistance Test Medicine Exam 6, and then it'll pop up here on my flow station as well. So I can see anywhere that there are current active notifications. So again, this will happen anytime you're subscribed to that notification. For Code Blue Rapid Response, any icon that's going to notify all the tablets, it will show up on your flow station even if you're not subscribed, as long as you're viewing a department within that site. And so if I'm, as an example, in a facility that has 5 departments and I am looking at another department and not subscribed, I'll still get that pop-up because we notify the entire site when there's a Code Blue Rapid Response type that is going to notify all the tablets in that site. And the other piece here is that on occasion, it's not very common, but on occasion, we do have situations where there is a Code Blue and a rapid response that are live. And in the past, those would kind of go over the top of each other. So this will now list them in order and sequence so you can see what all of those might be that are currently active and respond appropriately. On the tablets, you'll have the same functionality. Here, we're just saying that we have that Code Blue that's needed. We need a response there. You'll see if there's more than one, you'll see multiple. Right now, there's just the one. If you clear that icon here, if you just hit the X, that's not clearing the icon. That's just clearing the notification, the pop-up. But you'll still see this one in the bottom corner. And if you click on it, then you'll bring back the notifications for what is currently live. So that's going to be for your rapid responses, for your Code Blue type notifications. There are also some workflows that we have in some health centers where they want to notify, as an example, if a medical assistant is in another room in that department, they want a pop-up for that medical assistant. And so it's not going to do the full text to speech. It's not going to say MA needed in exam 4, but we can have just the sound for that icon. So the ding come through and notify only if there's staff in the room with a patient. And so that is an option that's available. As an example, we have a dental department where if the dentist needs a dental assistant, it will notify in other dental operatories in that department. And so that's another option that is available. And we have some health centers that are utilizing that already. So there's just a lot there on action alerts and being able to visualize those. That's something that we're building out. That two kind of bidirectional communication is exciting for us, and so we want to keep building on that. I think there's a lot more opportunities there, and so as you get accustomed to using that functionality that's there and training your teams on it, feel free to reach out if you have ideas on ways to continue improving that. Next, this is just tied to really Code Blue Rapid Response, anything that is dual verification. And so on the tablets, it'll pop up and say, are you sure that you want to continue? This is the screen that you would see. And so what used to happen is you would just have a button that said proceed to click, and then you'd have the cancel button. Cancel is still here. If you don't do anything for 10 seconds, it will automatically cancel. But now if you want to proceed, there is just a workflow that you need to hold this button for 3 seconds. So this is just hoping to help with accidental pressing of this button. And so if I press this now, then you'll see it goes 3, 2, 1, and then we're going to trigger that notification, which again is going to show this pop-up on that tablet and on all of the tablets in the clinic. That's just making that a little easier to avoid your automatic or your accidental clicking of the Code Blue icon. I don't have a screenshot of this, but if you trigger it from the flow station, there will just be a pop-up that says type yes to continue. As soon as you type yes, it'll trigger that icon. And so that's for, again, anything that we have selected to be dual verify that we want to verify before we trigger that icon. You'll see that workflow. Next, for room assignments, in the past, the system has really supported that you can have each room is assigned to a single provider. And you also had a nurse visit option that would just be a generic nurse visit icon that would look like this. And so the picture here is showing which provider this room is currently assigned to. There's now an option to assign multiple staff to a room. And so we have departments where they'd like to have either a room that's shared by multiple providers, or they want to indicate that maybe a nurse is really the primary responsibility for a room, but there's a provider that's also assigned. Then you have those options now. So not only can providers be assigned, and you can have multiple providers assigned to a room, but you'll have the option to assign non-provider staff to a room. So for now, we have Dr. Fortin here is assigned to this room. In the middle, you're going to see the staff that are in the building. This was a demo environment, so we didn't have any staff it was showing in the building, but any provider or support staff that are in the building will be shown here. So this is kind of your short list. And then on the right, you'll see all the staff in the organization that are available. So here we'll say Dr. Fortin is assigned to this room, and then we'll add MA James, and you'll see both of them are shown here as both being assigned to the room. Same thing you'll see on the flow station. Either you'll see two people. If there's more than two, then you'll just hover, you can click on it, and then you'll see the other people. So here, if we assign Dr. Fortin, MA James, and Nurse Amanda to this room, now we have 3 people. You can see how we show the first one, Dr. Fortin, and then a +2 for the other 2. Just hovering on those will also show who that room is assigned to. Related to this, if in the past you've had notifications and you can say, I want to be notified for a provider. And so anytime a room is assigned to a specific provider, you can receive a notification. As an example, if I'm a medical assistant, I likely don't want to be notified for the whole department when an MA is needed, but maybe I want to be notified when my provider needs an MA. There's now an option, we're including non-provider staff in this. So say I'm a nurse and rooms in my department are assigned to nurses, then I may say, I want to be notified anytime one of my rooms needs a nurse, or I may want to be notified anytime a patient selects a nurse call button from one of my rooms. And so that option is now available, whether to include non-provider staff. Just tied to multiple staff assignments, this is just showing that the provider +2 there. So those are some of the communicate pieces. There's a lot there that's going to be embedded significantly into workflows as far as affecting what you're doing slightly on the tablets and adding some functionality there. And then also some workflow opportunities that you have on the flow stations as you log into your computer as well. Just want to give a quick product update, a status update. We started about 6 months ago with a new beacon redesign. So, and the intent then was we're going to take about a year on this. We just received our last set of prototypes. And so we're going to start ordering injection molds and doing a lot of sort of fun, sort of challenging stuff there, but we have it more or less designed. Just a couple of things we want to highlight on this. First, it's going to have a built-in clip. Right now, this looks open. There is a spring clip in here, so you can clip it like a carabiner. And then this is a button. When you press that button, it will show green, yellow, or red for the beacon's current battery life. So it'll allow you to test what the battery life is. And then on the bottom, there will be a micro USB charging port that's a lot easier to access than the current beacons. So as far as status and timeline on that, I would say 90 days to our first production set arriving and being ready to go out. But we're making some strong progress on the new beacons. Then last, just want to give a couple updates on the reporting. There's not a huge amount here. The first is that you're going to have some additional, when you look at the patient history report, if you'd like to look at a specific patient, you're going to be able to see a little more information about their appointment. I've blocked this out because this was from a real patient, but we have their appointment ID, their patient ID, their appointment type, time, and then when they actually arrived at the clinic, which room they were in, and how when they started and ended their time in the room. So you'll see that information. You also have the option to filter on an action. So here we're looking at any code blues that happened on this date, July 22nd, and then we've expanded this one. One of the things that is new on this is, as an example, you see code blue. This is indicating when the icon was pressed. So this is the start time and the end time of when the icon was active for this patient. That's what the yellow bar here means. In green, you're going to see the time that support staff are in the room. So any green is support staff, and then a blue is a provider. The black is showing equipment. So here they brought a vitals cart into the room. So for this patient specifically, we had an MA come into the room for intake, came back in for a second. They were in for 2 or 3 minutes, and then they indicated that there was a code blue for that patient. And then you can see we had a bunch of staff that came in about a minute. Within about 90 seconds, we had 4 staff that were in the room with that initial MA. So this is really useful, first, for looking at any sort of event like this that you want to evaluate what was our response. Second, it's useful to evaluate if you have a patient complaint that comes in and you want to see, well, how long did they wait? Here, this patient was alone for 16.5 minutes. That might be something that you're looking at and kind of evaluating versus maybe a patient's perception of what their wait time was and the staff perception of what that wait time was. And then third, people are using this for tied to any sort of infectious disease. So sometimes we have health centers where they have an icon that indicates that you need to wear PPE into a room, and then they're going back and evaluating. Let's see all the patients where PPE was required and who was in the room with those patients and for how long. So lots of functionality that's available there. You can search based on all the patients that a staff saw, and then any icons where a specific icon, any patients where a specific icon was used, as well as the patient ID or account number for when a patient was in the clinic. And this is the last piece. If you drill down on any of the reports, you're going to end up on a detail page, which will show you the room name. It'll show you any of that EHR integration information, as well as when they started and ended their time in that room. There's now, if you hover in the top corner, you'll see 3 dots. And if you click on those, there's an option to export the data to an Excel spreadsheet. So we have some requests to export this data and look at it and kind of digest it in an Excel spreadsheet and maybe integrate it into your existing reports. And so that's available here in this export data functionality. So those are the updates that we have pushed out recently. That will go live basically overnight tonight. And so overnight tonight is when those updates are going out, and then they will be available starting tomorrow morning for our health centers. As far as next quarter roadmap, we have a couple of things that we're beta testing. And so we have some customers that we're working on these things with. The first is a benchmarking option. And so this allows you to look at other health centers' anonymized data. And so we've scrubbed provider names, site names, facility names, organization names, any patient information, obviously, and then any staff names or information has been scrubbed out of that. But it allows you to look at your data side by side with that of other organizations and get a feel for where you're at relative to other organizations. We're currently, I believe we've signed 2 or 3 organizations that are planning to be part of that benchmark. And so we're going to get some feedback from those organizations and then make that generally available once we've finalized with that feedback. So really this quarter is just a benchmark, just beta testing for that benchmarking functionality. Second, we've built out a lobby view option. And so we're beta testing this with 1 customer. And that is an option to show on television screens in the lobby which providers currently have patients waiting and whether they're on time, ahead of schedule, behind schedule, and how many patients are waiting for each provider. That'll also, it's not just permanent on that screen. It can slide and do some patient education. It can show any other information that your health center would like to show on that screen is available. And that is something we are beta testing. I'd anticipate that's going to be the full quarter. Q1 is when we'd start making that generally available. We are automatically calculating what the provider status is. So, if they're ahead of schedule, on schedule, or delayed, and how many minutes delayed. However, there is an override functionality where you can select from a dropdown. No, actually, this provider is 10 minutes delayed. They're not actually running on time. And so those are some of the pieces there that we're pretty excited about that functionality and looking forward to getting some more customer feedback during this quarter. So those are two things. We're really just working on beta testing for those two this quarter. As far as roadmap, we've added some things into the long-term plan. We're working on wrapping up the hardware optimization of beacons. And so in the next 2 quarters, this last one will be wrapped up. We're also doing a lot more on EHR integrations. We are adding some bidirectional HL7 interfaces for some clients that have requested those. We also are interested in building out an integration with orders. We do need a partner health center to do this, but the idea here would be that ordering something within your EHR would trigger a workflow on the SyncTimes side. And so that's something that we're excited to do. I would guess that this is over the next 12 months. And we're looking for a partner health center who's really interested in doing that on their end. A couple other things that we'd like to do in the next 12 months that are on our roadmap, expanding the survey functionality. And there's kind of 2 ways we're thinking about this. Currently, we just have really a happy or not survey that's available. We'd like to build out something where patients can respond more throughout the visit. And so this would give them the chance to respond, how was the intake process? How was the check-in process, rather than just being that one survey given throughout. And the goal here would be to make the data a little more actionable around, what is driving the patient satisfaction. Is it their lobby wait? Is it the time that they're waiting for their provider? Is it that, when this provider gets to the room, patients just love them and their satisfaction is going up immensely. And so that's something that we're looking at building out more. I think we're thinking about that first, obviously on the tablets, because we already have those, but second, also potentially having a mobile option there where a patient may receive a text message or other way of responding and saying how their visit's going. Next, patient self-rooming. So the idea here being that when a patient arrives, the tablet can indicate that, welcome to the clinic, Alan, as an example. And then when they get to the room, they just hit a button to check themselves in. And that triggers a workflow that says to the medical assistant, we're now ready for you. We have a couple health centers that are interested in this, and that's something over the next year we're going to be working on more. And then third, we'd like to build out currently for kind of a panic situation. We do have the tablets first off, but then second, we have pull cords, we have nurse call buttons, and then we have duress buttons that would go under a desk. We'd like to build out something that's wireless and mobile, perhaps tied to the beacon. And so that's something in the next 12 months, we're going to be working on that. And that'll be after we wrap up this hardware optimization project on the beacon side. We have our engineers pretty busy on that right now. But the idea there is that if a staff member is in a shared area or an area where they're not close to, say, a tablet, they could hit a button on a card or on their beacon on a piece of hardware that would trigger a notification and say, we've got a panic situation in the lobby. And so that's the goal there. So this is our roadmap for the next quarter. Again, we've got that survey. Love to get any feedback. We're also, if anybody has any feedback that they'd like to give here, we're all ears and excited about some of these things we're building out for the next quarter.